Coronavirus infection. Control, disinfection, and sterilization by Professor Hazem El-Ashmawy, Professor of Internal Medicine. Member of Arabic Association for the Study of Diabetes and Metabolism, AASD. There is currently no vaccine to prevent coronavirus infection. The best way to prevent infection is to avoid being exposed to this virus. However, as a reminder, Centers for Disease Control and Prevention, CDC, always recommends everyday preventive actions to help prevent the spread of respiratory viruses, including: avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Scientists believe this coronavirus started in another animal and then spread to humans. So health officials recommend cooking meat and eggs thoroughly. Anyone with underlying medical conditions should avoid live animal markets and raw meats altogether, since those people are considered at higher risk of severe disease, the World Health Organization says. Follow CDC's recommendations for using face mask. CDC does not recommend that people who are well wear face mask to protect themselves from respiratory viruses, including coronavirus. Face mask should be used by people who show symptoms of 2019 novel coronavirus, in order to protect others from the risk of getting infected. The use of face masks is also crucial for health workers and people who are taking care of someone in close settings, at home or in a healthcare facility. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. Recommendations for clinics and healthcare facilities. 1. Minimize chance for exposures. Ensure facility policies and practices are in place to minimize exposures to respiratory pathogens including coronavirus. Measures should be implemented before patient arrival, upon arrival, and throughout the duration of the affected patient's presence in the healthcare setting. Take steps to ensure all persons with symptoms of suspected coronavirus or other respiratory infection, example fever, cough, adhere to respiratory hygiene and cough etiquette, hand hygiene, and triage procedures throughout the duration of the visit. Consider posting visual alerts, example signs, posters, at the entrance and in strategic places, example waiting areas, elevators, cafeterias, to provide patients with instructions, in appropriate languages, about hand hygiene, respiratory hygiene, and cough etiquette. Instructions should include how to use face masks or tissues to cover nose and mouth when coughing or sneezing, to dispose of tissues and contaminated items in waste receptacles, and how and when to perform hand hygiene. Ensure that patients with symptoms of suspected coronavirus or other respiratory infection, example fever, cough, are not allowed to wait among other patients seeking care. Identify a separate, well-ventilated space that allows waiting patients to be separated by 6 or more feet, with easy access to respiratory hygiene supplies. In some settings, medically stable patients might opt to wait in a personal vehicle or outside the healthcare facility where they can be contacted by mobile phone when it is their turn to be evaluated. 2. Adherence to standard, contact, and airborne precautions, including the use of eye protection. Standard precautions assume that every person is potentially infected or colonized with a pathogen that could be transmitted in the healthcare setting. Elements of standard precautions that apply to patients with respiratory infections, including those caused by coronavirus, are summarized as follows. Hand hygiene. Healthcare providers, HCP, should perform hand hygiene using alcohol-based hand sanitizer, ABHS, before and after all patient contact, contact with potentially infectious material, and before putting on and upon removal of personal protective equipment, PPE, including gloves. Hand hygiene in healthcare settings also can be performed by washing with soap and water for at least 20 seconds. If hands are visibly soiled, use soap and water before returning to a BHS. Healthcare facilities should ensure that hand hygiene supplies are readily available in every care location. Personal protective equipment, PPE. Employers should select appropriate PPE and provide it to HCP in accordance. HCP must receive training on and demonstrate an understanding of when to use PPE, what PPE is necessary, how to properly dispose of or disinfect and maintain PPE, and the limitations of PPE. Any reusable PPE must be properly cleaned, decontaminated, and maintained after and between uses. Gloves. Perform hand hygiene, then put on clean, non-sterile gloves upon entry into the patient room or care area. Change gloves if they become torn or heavily contaminated. Remove and discard gloves when leaving the patient room or care area, and immediately perform hand hygiene. Gowns. Put on a clean isolation gown upon entry into the patient room or area. Change the gown if it becomes soiled. Remove and discard the gown in a dedicated container for waste or linen before leaving the patient room or care area. Disposable gowns should be discarded after use. Cloth gowns should be laundered after each use. Eye protection. Put on eye protection, example goggles, a disposable face shield that covers the front and sides of the face, upon entry to the patient room or care area. Remove eye protection before leaving the patient room or care area. Reusable eye protection, example goggles, must be cleaned and disinfected according to manufacturer's reprocessing instructions prior to reuse. Disposable eye protection should be discarded after use. The Arabic Association for the Study of Diabetes and Metabolism, AASD, wishes you a healthy and safe life. Thank you.